Hi, my name is Abby Sainer, and today we're going to be talking about scooting and positioning a patient before and after a transfer in sitting. It's important to scoot the patient to the front of the seat before a transfer because this is going to create the smallest distance between transfer surfaces. It's also important that we get their knees directly over their feet so that their center of mass is directly over the base of support, which will provide the most stability and balance for the transfer to follow. After a transfer, it's important that we position the patient at the edge or at the back of their seat because this is going to provide the most safe and comfortable position for the patient. A few key components we have to consider before positioning the patient. We need to assess the patient's assistance level and if they have any impairments or wounds that could get in the way before positioning the patient. We also need to make sure we're communicating with the patient so they know what to expect when we're positioning them and so that they can tell us if they're having any pain or discomfort. Lastly, we need to remember as healthcare professionals, we have to protect ourselves and make sure that we are bending with our legs and not bending over on our back to prevent injury. A few things we need to prep before positioning the patient. We want to make sure that everything is set up for the transfer that may be taking place after the scooting process. We also want to make sure that the patient's ready. So in this case, you might have a gait belt on or have the bed unmade if you're going to a bed. Right now we're just demonstrating the scooting process, so we don't have Brooke by a bed. We also want to make sure if she's in a wheelchair that it's going to be locked and that the footrests are out of the way for the transfer that's going to take place, and so that we're able to get around the wheelchair fine. The method we're going to discuss today is the unilateral side-to-side weight shifting. So we're going to bring Brooke forward to the front of the chair, and to do so, we're going to have one arm around her shoulder and then one arm on that posterior pelvis. With the arm on the shoulder, we're going to scoot her to the side, and she's going to lean forward with me, and that's going to unload the side that I have my hand on her posterior pelvis. This will allow us to scoot her forward, and then we're going to bring her back and do it the opposite side, scooting her again closer to the seat of the chair, and repeat the process until she reaches the front. Also make sure that the healthcare professional is standing in stride in front of the patient and maintaining contact the whole time to protect the patient. To use this method to go backwards, we're going to just, instead of putting our hand posterior on her pelvis, we're going to put our hand under her thigh and just lift up just enough to clear the surface and then bring her leg back. And then we're going to repeat the process on the opposite side. Again, unloading and shifting her back. Brooke, we're going to scoot you forward. Is that okay? Mm-hmm. Contact guard the whole time. Good. And you'll just continue that until she's at that edge. Now we're going to go backwards. So I'm going to lift your leg, this time scoot her back. And contact guard until she's safely. Next we're going to go over the bilateral pelvic scooting method. So for this scooting method, we're going to have both sides of Brooke's pelvis move forward at the same time. So I'm going to place my hands on her posterior pelvis and I'm going to slide her forward. At the same time, she's going to help me with pushing up. So Brooke, can you put your arms on the side of the rest for me? Armrest for me? All right, and then you're going to push through your arms and your legs at the same time while I scoot you forward. All right? Now I'm going to make sure I'm standing in stride and I'm not blocking her knees, I'm just guiding them forward. And Brooke's going to lean forward into me. All right, on the count of 3, Brooke. 1, 2, 3. Good. And then if we were going to go back, I'm just going to move my hands around the side to her pelvis. Okay, ready, Brooke? 1, 2, 3. Good. We could also use the gait belt to help us with the same method. All right, Brooke, I'm going to place my hands on the side of your belt, and you're going to push up with me on the count of 3. Ready? 1, 2, 3. Good. We can also use a sheet to do the bilateral pelvic scooting method. This time you're going to stand in stride in front of your patient. You're going to make sure that you don't block the knees and that you're going to guide them forward. We're going to have the patient use their arms on the outside of the bed. So Brooke, can you place your hands right there? And together we're going to lift and scoot her forward. So she's going to push through your arms and your legs, and I'm going to put my hands, use the sheet, and put it just a little bit behind her and bring her forward. So on the count of 3, Brooke, we're going to scoot forward. And I also need you to lean forward into me a little bit. All right, perfect. On the count of 3, 1, 2, 3, lift. Good. So to recap, we want to make sure that we're always contact guarding the patient, make sure that you're always maintaining proper body mechanics, and make sure you're always checking in with the patient and make sure they're comfortable and safe.